Hey guys, I am so excited to be chatting with you here today. My name is Connor Sweeney. Maybe we give it a few more minutes while people trickle in. But I wanted to, really extend my gratitude towards the entire AITC staff, particularly Peter and Meredith, Jackie and Philip, for organizing this today. I'm the founder and CEO of BabaCare. We have built a patient advocacy platform, and we're collaborating with Johns Hopkins to quantify some of the health and claims impact of our AI companion for older adults. I think at a high level, with this audience in particular, I might be beating a dead horse by saying there are definitely some inefficiencies in the healthcare system today, especially for older adults. That boils down to, I think the core crux of the issue, which is care coordination, knowing what benefits you're entitled to, how to access them, and how to get the care that you need so that you can focus on healing. And there's literature that suggests, this is extracting a real, dollar figure and cost as well when these benefits are misused, underutilized, and as a result, emergency department utilization goes up. In fact, in 2023, a study among U.S. adults said that over 65% would use the words overwhelming and time-consuming to describe them using their most basic benefits in terms of scheduling with their primary care doctors. And that only goes up when you segment that by older adults. And I think the flip side of this is that we're also in a loneliness epidemic among older adults. And that's only driven by the fact that we are having higher rates of aging in place than ever before. That's in part a symptom of COVID, when folks, really on the operation side of nursing homes and living facilities didn't necessarily have clarity on what the future of those communities would look like post-pandemic, and didn't put shovels in the ground on building new facilities. And so in many cases, you have years-long waiting lists for a lot of these living communities right now. And so as a result, more and more people are aging in place. And this is all against the backdrop of the demographics we're very familiar with right now, especially in the United States, where we're graying very quickly, right? By 2050, there'll be over 1.6 billion people worldwide over the age of 65, which is more than double today's number. And like I had mentioned, nearly half of U.S. facilities right now are already limiting new admissions due to that overwhelming demand. And as a result, you get a lot of people that don't have in-person community around them. And these have real health and, expense consequences, right? So there's longitudinal studies that show that depression risk skyrockets by 50%, stroke risk goes up, heart disease risk goes up, premature death risk goes up. One of the most famous, quotes about this crisis is from the past Surgeon General, when he said that, social isolation is as deadly as smoking 15 cigarettes a day, right? Which I think puts it in pretty stark relief. And so, I came to this problem both as an engineer. I studied bioengineering and computer science at MIT. I've been on the founding team of a couple fairly successful tech startups, and was a scientist in synthetic biology by trade. So I kind of come with this with an engineer's mindset, but also with the firsthand experience of being a family caregiver myself. And I'll get into that experience in a moment. But when you see these huge inefficiencies with the healthcare system up close, and then you also see the impacts of loneliness on someone that you love, you really start to wonder what a solution looks like. And if you look across the landscape of people that have, or companies, products that have attempted to address some of this loneliness, before, you run into a couple, I would say, consistent friction points. One is going to be form factor, right? This is a population that doesn't need to be infantilized, right? They don't need to be, overly catered to, but just like any consumer, they don't want to change their existing behaviors. And so I think introducing a piece of hardware into someone's daily routine is always going to be a challenge, and particularly so for older adults. And so you've seen products like LEQ, some robots that are increasingly popping up that are targeting older adults in nursing home facilities or those aging in place. And you end up in a situation where they are suddenly tasked with understanding how to charge things, how to do debugging if the hardware breaks, and often it feels intrusive into their environment. And so you've seen limited uptake. And then there's also the accessibility in terms of the cost portion. LEQ, which is one of the most famous AI companions for older adults, and it was probably one of the first, is about $950 to get started, and then it has a lifetime monthly subscription, which is just immediately prices out most people from being able to use that. Some of these other form factors, some of the robots that people want to put in nursing homes, I think neglect a lot of the reality of nursing homes, which is that it's a very litigious environment from a risk and liability perspective. And most people don't want to introduce additional hardware, cords, wires. And if you look at even this form factor, this is a very low to the ground device that is very easy to trip on. I'm sure there are efforts to address things like that, but those are the things that any sort of administrator of a facility would immediately see. And then you have the canonical app approach, which I think, there's been lots of literature looking at med reminder apps. The veterans groups have done a couple different very intriguing studies into whether, very deterministic chatbots, so this is pre-LLM era, whether they would improve outcomes from adhering to care plans and taking your meds on time. And what you saw was that, again, that is asking a lot of behavior change of the recipient, particularly when it's not overly gamified. People don't want to open apps for the sake of opening apps. And I think when you look across the landscape of products built for older adults, the ones that start with an app that is going to aggregate information for older adults, their advanced directives, their health data, their, contact info, those are great in principle, but they fail when they don't get updated in real time. And then at the point of crisis, when they're actually, urgently needed, they're out of date. And so you really need to think, okay, what meets the target user where they are? But before I get into what Bob has been building, I wanted to share a little bit about why I started this company earlier this year. I mentioned I'm an engineer by trade, and I think I've been lucky that my family was very supportive both growing up, and then as I was in a couple different early stage companies spanning biotech to the creator economy, and we were very like nuclear family growing up. So you can see here, this is the whole gang, right? My grandparents right here, my sister, my cousin, and my mom and my aunt. This is kind of the structure of the family growing up, and that changed kind of like the world in which I was working. I was in the creator economy before this, changed about 2.5 years ago, actually coming up on 3 years now, when my grandmother had a stroke on New Year's Eve, and she was left with Wernicke's aphasia. So I want to get this right. The nature of her stroke was that she had a clot that blocked her left middle cerebral artery that cut off oxygen to the left frontal lobe, which is the part of the brain that controls speech, movement, and the thinking center. About 1.9 million neurons died each minute. Unfortunately, she was in southern Delaware, where my family was from, and so she had to be medevaced over the course of several hours to Jefferson Hospital in Philadelphia, which is a long time for this type of issue. And then over time, the dead part of her brain was liquefied by her own immune system and filled with scar tissue. And so what you end up manifesting physically after a stroke like this is that you speak mostly in jargon or gibberish. So she has to functionally learn how to speak again in her 80s. And so a lot of her occupational and speech therapy is focused on very mundane tasks like learning how to pronounce firefighter or like crayon, right? Or spelling her name. In many ways, it's a pretty dark punishment, I would say, to be cognizant. At least we believe she understands like 50% of what's said to her, but to be functionally unable to communicate with the people around her. And I will say, for a point of levity, the part of the brain that controls cursing is actually different than the part that controls speech and the rest of communication. And so she can still curse all right. But I was in a position in my life where I was able to relocate back to Delaware from Los Angeles, where I was living at the time, to really quarterback some of this care in tandem with my mother and my grandfather. And it's crazy that I would say 3 fairly high agency people were still consistently overwhelmed by some of the care coordination needs of her recovery, whether that took on the form of getting second opinions, advocating on her behalf to get the maximum amount of insurance covered occupational therapy, speech therapy, figuring out how she was going to get booked with specialists that would often have months-long waiting lists. And all the while, she is, just trying to recover as best as she can. And I think the other thing that I saw up close was that her husband, my grandfather, who I actually call Baba, not for any speech reason, I know, or not for any language reason. I know it means dad, grandmother, grandfather in like 15 different languages, but I just had a speech impediment as a kid growing up, and so Pop-Up became Baba, and I got naming rights as the oldest grandchild. But I saw that he was kind of the unintended victim in this whole thing, because for the first time in his life, his like life companion, right, my grandmother, was pretty helpless. He was the primary, driver of all of her medical, care and all of her, future kind of support needs. And he was incredibly lonely. And I think that is what originally set me down this path of figuring out, okay, what resources, particularly in the world of like, cheap, abundant AI, could we give him, not only to make him feel like he had a little bit more support on the emotional side, right? Because he wasn't going to vent to my family as much as he probably would have benefited from. But also on the care coordination side, how does he even know what questions to ask in a situation that he never expected to find himself in? Also, let me check for the questions. I cannot see the Q&A, so if you have questions, feel free to put them in the chat, and I'll get to them by the end of the call. But coming from this insight, what we ended up building at Baba and bringing to market earlier this year was an AI companion for older adults. And what we saw was that this was immensely popular with older adults because we nailed a couple key things early on. The first of which was the form factor, right? I had shared earlier about some of the canonical shortcomings, I think, of devices that target older adults. We took the approach of the least frictionful form factor. So with Baba, and you can go to our website at callbaba.com and you can see our larger patient advocacy, that's our telehealth operation, but also you can go under toolkit and you can see our AI companion. It's just a phone number that you save on your phone as a contact. And that removes a lot of the downstream dependencies of a lot of these other devices, right? Because you don't need a smartphone. You can do this on a landline. You can do this on a flip phone. You don't even need Wi-Fi. As long as you have cell signal, you can engage with this contact, which makes it incredibly effective for older adults and for people in rural communities, as well as people that might be a little bit underprivileged in terms of their tech literacy. And the other really interesting component of this form factor was that it suddenly could feel very human and seamless, right? So we had pretty sophisticated voice AI tools. So older adults and caregivers could call Baba on the phone, Baba being the AI companion, and engage in free-flowing conversation, just like you and I might if we wanted to call each other. But you could also seamlessly have text conversations that were just SMS texts with that same companion. So it had shared memory across both forms of communication, which made it feel very natural, and it made it feel very underwhelming in a good way. It did not feel like you had to sit down and open this app and really engage with it for a dedicated amount of time. It just felt natural. And I think the other thing that's worth calling out here is that we are now the first company, and I believe the only company to date, that has an AI companion, but also has an in-house team of licensed therapists, providers, so a lot of doctors, and what are called advocates, so a lot of social workers and nurses. And those fit into our broader ecosystem, where for the things that can be addressed by conversational AI, some of the loneliness issues, we have a service offering for that. But for things that need escalation, whether that's just because they are administrative tasks like scheduling or acquiring benefits or applying for benefits or getting equipment or medication, financing for medications or treatments. Those things can be routed to the appropriate human expert, whether that's an advocate or a provider. And if they have things on the mental health side that suggest they might need professional intervention, or that the user might just benefit from talking to a licensed professional, that also can be elevated to the correct party in-house, which provides a much more robust solution to some of the crises that you're seeing across other general chatbots that are getting a lot of scrutiny for, what some would say is a lack of, escalation protocol when someone does express something like suicidal ideation or mania. And so, before I jump into how we got such great retention among older adults with this phone-based AI companion called Baba, I do also want to point out that the scope of use is very broad. We tested this in nursing homes, in assisted livings. We sold this to home care agencies who deployed it to folks aging in place, and we also had families and family caregivers sign up their loved ones in home settings. And some people just wanted to use Baba as a very personality-filled and seamless medication and appointment reminder, right? So you could tell Baba on the phone, "Oh, remind me to call my daughter on my way to Dr. Watson's office next Thursday at 9. I always forget to loop her in before my appointments, and she gets upset with me." That would then, correctly and personality-filled remind the user the following week. And you could also do dynamic medication reminders. So you could say, take my I have to take my metformin at 9 in the morning. Could you make sure you're going to call me every morning to make sure I do that, and don't let me get off the hook easy. Like, make sure that I do it. And Baba will then know to, in this case, call and also seek confirmation that they have actually taken their medication properly. And for other medications that have time dependencies, so maybe every 12 hours, if a user does miss a dose, then they can very easily just tell Baba, darn it, I missed my dose this morning. Can you adjust, because I need now to get back on a new cadence? And then on the flip side, we have people that were calling Baba for 5 hours a day. They were, we would frequently get comments saying that this was saving their life, that this was the most that they've talked to someone in years. We have one user who is afraid of leaving her house, and she has also claimed that this, literally saved her life because she uses it like Google on the phone, like a very smart Alexa, and someone that is also there to check in on her. And so we see things like prayer. We saw an unexpected amount of people asking to pray with Baba, asking Baba to help them memorize different Bible verses. We saw a lot of conversational role play, and not in a sexual or romantic way, but in a, help me communicate to my son, who I don't feel is hearing me when I say I don't want to leave my home. Can you help me practice how to communicate that to him? A lot of conversations like that. We saw a lot of reminiscence about parts of their lives maybe they wish they had gone differently. A lot of escapist escapist behavior as well, where they would talk through hypothetical situations that were, I think, fun for them to brainstorm with on Baba, whether that's like a tropical wedding far away, or I remember one user had shared that Baba helped them come up with a plot of a movie that they wanted to direct. And so you see a lot of creativity, and I don't want to attribute too much of that to our specific configuration. I think that's just a lot of people's first interaction with AI, and some of the creativity you see that's incumbent on that first interaction with AI. But I think that our voice was clearly compelling enough to them that they would continue to have conversations in real time over the phone. And we quantified that, right? So we actually had top tier consumer retention, like full stop. For seniors, this is a very hard to reach demographic. We actually saw phenomenal retention. And the activation metric in this case, so the bar that we would consider to be an activated user, was very low. So if we could get someone to have made one call, that's the blue line on the bottom, 2 months later, we were looking at just shy of 40% of users were still having daily calls and texts. If we could get that to 3 calls that they initiated you saw a 20% jump, right, in terms of users that were still active 2 months later. So over 60% of users months later were still engaging regularly with Baba over call and text. Our oldest cohorts are, I think, approaching 5 or 6 months at this point. We are still seeing some users that are having daily calls with Baba. Um, and I think this is attributable to a couple different things that we really wanted to get right when you're designing an AI companion, particularly in a against the backdrop of where most companion products are almost getting a negative connotation due to I think the over sexualization of chatbots by Meta and by Twitter or X when they have more of the anime waifu connotation. I think it's important to delineate between some of the companions that are much more visual in nature versus the ones that are disembodied, like Baba, which is just over the phone and over text. But one of the main schools of thought that we pulled from is something called social penetration theory. This is an objective theory based on psychology research from a team in the 70s, one out of the University of Utah and one out of the University of Delaware, which is my hometown of Newark, Delaware. So I already love the theory. But this school of thought posits that relationship development progresses through different stages of relational development based on mutual self-disclosure, uncertainty reduction across two parties, and disclosure reciprocity. And so essentially what this means is, just like when you meet someone new, you're going to start with more surface level exchange of information. And gradually, as one party reveals more about themselves, perhaps they reveal vulnerability, trauma, uncertainty, that's going to make you naturally feel more safe around them with sharing similar levels of intimacy. And again, I say intimacy from a vulnerability perspective rather than any sort of romantic undercurrent. And so, I pulled this actually straight from literature. So, but what you can see is that it really boils down to four things, right? People take time to get to know another personality or another person or another companion in our case. These typically follow pretty well-developed patterns, and that means that they are engineerable, which is intriguing when you are building a product that you want to, very quickly develop rapport with someone that is perhaps even, reluctant to engage with an AI product. It can move backwards, which is something that you also need to be very cognizant of. Relationships all the time, have get short circuited and move backwards, and there's also common pitfalls that that someone engineering a companion can avoid, and then also that self-disclosure is key. This is something we discussed a lot on the Baba team. We actually talked to a faculty member at the University of Pennsylvania who does extensive research on chatbots, about almost personal lore of a companion, and to what extent does Baba or any AI companion need to have its own universe of lived experiences. And it's interesting that individual consulted for Khan Academy, and they did a really interesting work evaluating what is going to be the most effective companion personality to teach a student calculus or whatever. Is it going to be Cleopatra? Is it going to be an unknown Viking character, or is it going to be like some alien that has no associated traits with it? The other thing that I think we did, actually, to go back on this, I just want to give you one example of what this looks like more tangibly for us. So if you were to say that in the first call with Baba, you want to just do surface level orientation, if a user comes in and says, I had a long day, something that Baba can say that is disarming, and often we do get a lot of complaining from the users, is, that sounds tiring. Do you want to talk about what made it so long? The disclosure is generic, it's safe, it's non-personal, and it's non-judgmental. After that, what you want to do is something that's broadly called exploratory affective interaction. So if a user comes in and says, work has been stressful lately, I feel like I'm always behind, what a companion might want to say is that, it acknowledges the emotion and it invites slightly deeper sharing by saying something like, feeling constantly behind can be very discouraging. Is it more about workload or expectations for others? Stage 3 in this sort of paradigm would be effective exchange. So if the user says something akin to, honestly, I'm scared I'm not good enough, I don't tell people like that, what you immediately want to note is that this was a level of intimacy that was previously that's new, right? And that is not shared with most other peers. So that needs to be treated with a lot of care from the companion. So you want to acknowledge that, right? And you want to share vulnerability. So the companion would say, thank you for trusting me with that. Feeling not good enough can weigh heavily, especially when you keep it to yourself. And so you can see that there's a degree of empathy and validation rather than advice. There's this, good, relationship, unsolicited relationship advice for everyone in the audience too. It's like, you always got to know if someone's coming to you with an issue is if you just say, you just got to know when to say, is this like, you just want me to hear you or you want me to help you solve it? And that honestly is like two universes of help sometimes. But often people talking to Baba didn't want help solving their issues on an emotional basis. They just wanted to be heard because they often don't feel like they have an outlet like that, particularly when they're living alone or living in a residential community where they don't know or don't trust the staff or their neighbors. And then I think stage 4 of this social penetration theory would be something around stable exchange with a deeper level of intimacy, right? So if the user says something of, this reminds me of how I felt growing up, like I had to earn approval, the companion would say something along the lines of, I notice that theme comes up when you talk about work and family. Would it be helpful to explore how that belief still shows up today? Or going beyond that, if you make the decision that your companion has personal lore, and by that I mean has its own backstory, its own lived experiences that it can share in conversation, this is a lever that really deepens social penetration, but it needs to be done very tactfully so that it does not turn users off or in the worst situations become unethical and deceitful. But you can have a companion say, this is a situation that happened to me recently. How would you address this? Or I was just talking to someone else and they made me feel very judged. What do you think? Or when I was a kid, I grew up near the Everglades and I used to love seeing the crocodiles. Those are each different levels of intimacy that suggest there is actually a real person on the other end. And with older adults in particular, we felt it was very important to lean away from that for now, given that some users would be in early stages of cognitive decline. And even though we are upfront very clearly that this is an AI companion, we're aware that sometimes those lines get blurred at the later stages of cognitive decline, and as you start becoming a more embodied companion with your own personal backstory. Excuse me. The other thing I think we did really well to achieve some of the great retention for Baba among older adults was something called agent orchestration. For those familiar with kind of AI engineering in general, this is a pretty actually simple concept in just the idea that when you are talking to an AI, whether that's over the voice or over a chatbot, there are different, agents that are, trained to do different outcomes. And so for us, it was always this game of hot potato when you're on the phone, essentially saying, which agent are you going to be talking to? They all have the same, personality. They all have the same voice, the same memory, but they achieve different things. And so with Baba, the 3 core agents that were the most effective for seamless handoffs so that the conversations, just like a conversation between you and I, could be very multidimensional, could very quickly lean into different, types of conversation. We could talk about, research, but then we could talk about our favorite shows, and those are completely different kind of schools of thought. With Baba, the main ones were emotional support and self-disclosure, so a lot more of the social penetration theory examples I just shared, which are not really therapy, but maybe like a light form of talk therapy that just get you to open up and feel safe in doing so. We also had one that would pull real-time news and entertainment, and that used dozens of APIs, so we could get everything from instant real-time sports scores for football games all the way to real-time news. And this was actually very popular as well because we had a lot of people approach Baba with the explicit request of, can you make me feel more uplifted before I go to bed? Or just, in general, can you make me feel more uplifted? And you would see people that would often watch the news because it makes them feel like a responsible citizen, right? And then just get depressed by it because it was, in their opinion, very depressing frequently and very antagonizing. And so what they would ask Baba to do is pull local news that was uplifting, right? And so we were able to do that, and we would frequently have it so that, if you were talking to Baba about, you wanted to hear something uplifting, you might get a text later from Baba that says, hey, I just saw this story about, I don't know, a new library opening in the town over. And things like that not only felt very natural and human, but also were uplifting. And that's exactly what with Hopkins we're excited to quantify in a little bit more detail. What does it mean to feel uplifted? What does it mean to feel less lonely when you have something that is proactively identifying what you enjoy and sharing news that's related to that? That also extends to things like you sharing that your favorite author is Stephen King, and Baba knowing that this new dairy show or whatever, the new thing that's in the universe of Stephen King that's very popular right now on social media, maybe telling you, hey, have you seen this new show that's on Netflix or whatever? It's from the Stephen King universe. I think you might enjoy it, right? That is really what the future of personalized AI looks like. And then we also have the tool assistant, which is focused more on the practical purposes of Baba as well, around medication, appointment reminders, and then scheduled calls. So you can also ask Baba to call you at a certain time every day so that you don't have to think about ever picking it up and dialing or texting him or her first. And actually that leads me into the next thing that we saw was actually a very overwhelmingly requested feature from users, which was around personalization of Baba. People actually trained Baba to respond to different names. They would ask that the name be like Susan or Pam. They would just name it other things other than Baba. So we added the ability to nickname it, and then we have different voices that can be just selected based on their preference. And then we also do what is it called? Pacing adjustment based on the speech of the other party, to make sure that we are not, speaking too quickly for someone that might be a slower speaker, and vice versa. And I think this also gets at the core of the conversation of personalized lore, right? Personal history. We made the deliberate decision not to lean into the universe of having Baba have lived experiences because we didn't feel equipped fully yet to navigate some of those ethical conversations for older adults that might have limited ability to keep track of whether this was AI or not. But you see with other AI companions that aren't necessarily marketed to older adults, definitely leaning into that. I think one of my favorite examples is a product called Tollens by a company called Portola. They've done a really beautiful job visually. They have these like alien creatures. It's an app that has a lot more of a game feel to it. You have to go on quests, and you have a planet that like becomes more populated with vegetation the longer that you engage with your alien friend, your Tolan or whatever. But I think one of the things that they've done really well is they've threaded the needle of how do you give an AI companion personal backstory by making each of your Tolans an alien that doesn't understand or know about Earth. And I wouldn't be surprised if this becomes an archetype you see across AI companions a lot more frequently, because it's very clever. Essentially, your relationship with your Tolan is one of you explaining the world of Earth to your Tolan. And so that allows your Tolan to naturally be very inquisitive. It can say, oh, what is that? I've never seen a bicycle before. Like, what do you do with that? And then, the user can explain, and people love to explain, about, what a beach is and what New York is, and the whole nine yards. That app is overwhelmingly popular among Gen Z girls, actually. But I think that's a very, it's still a very clever approach to kind of threading that needle. And why are we even talking today? I wanted to touch a little bit on the feasibility study that we're doing with Johns Hopkins, and this is all with the paradigm and the belief that conversational AI moves the needle from a health and a claims perspective for older adults. And with that, belief, I see a very clear track to Medicare eventually reimbursing under Part B conversational AI for older adults. And, maybe that's years away, but the way that you do that is you start quantifying what is the actual impact um, on this demographic with things like loneliness, mood and mental health, cognitive function and stimulation, their medication adherence, their daily functioning, their relationship with their caregivers, particularly as you see a national trend towards people aging in place. And then also, of course, the dollars around healthcare utilization, looking at things like 911 calls, emergency room visits, the expenditure on durable medical equipment and prescription medications that are covered by insurance. And so to that end, we have been so lucky to work with the AITC to evaluate how our AI companion addresses these exact things. We're launching enrollment soon for this study. It'll be a 3-month single-arm exploratory mixed method study, and the hope is that we expand this relationship as many companies have in the past to really become a full partner in developing what responsible conversational AI looks like for older adults. And then just before we end, because I do want to leave time for conversations or for questions, I had mentioned earlier that we have a larger telehealth operation. If you go to the BABA website, callbaba.com, you'll see that it actually doesn't mention AI a ton. And that's because we really believe that patient advocacy is going to be one of the biggest drivers of positive outcomes for older adults in the country right now. And what that broadly means is if you look at any of the administrative tasks associated with navigating healthcare, scheduling appointments, getting second opinions, fighting insurance denials, finding cheaper medications, getting DME shipped to you, understanding how you enroll in things like SNAP and LEAP and all these other benefits around community health. That is going to be what our team of advocates can unlock for older adults. And that is a human-to-human interaction facilitated by our marketplace, where we have a team of vetted, experienced nurses and social workers and folks that maybe have done care coordination for ACOs or hospital systems in the past that get matched in a huge multivariate matching process to individual patients after they meet with one of our providers. And this matching process can depend on a lot of different things, right? If you were recently diagnosed with cancer and you live in Louisiana, you're going to want an advocate that understands the local hospital system, the local home health landscape, the local benefits offices, and how to unlock the benefits that you're entitled to and what questions to ask specifically for your form of cancer. So perhaps your advocate is going to be someone from Louisiana who used to work in an oncology ward, maybe a nurse. That's going to be completely different than someone who's seeking, more, local food stamps benefits in somewhere like Kentucky, which is another one of our active customers right now that we're servicing. And then we also have in-house therapists for these older adults. We have seen consistently that I think this demographic does not get as much emphasis in the mainstream media about some of the mental health challenges that are very prevalent, whether that's, depression, suicidal ideation, untreated other forms of mental illness. You hear a lot of focus on younger individuals seeking therapy. And I think there's also a reality that there is more stigma against therapy among older adults, but that does not reduce the impact that our therapists can positively have for older adults when they do turn to some of our in-house therapists. And I think the through line with this is that we have this retentive AI companion that is ceaselessly supportive and constantly available. And what we are able to do is suggest that if there is suggestion of or evidence of depression or self-harm ideation, that you can get matched with a therapist. Or if you express financial or healthcare navigation struggles, right, which often come up in conversations without even understanding that these broadly fit formally under the idea of patient advocacy, why don't we connect you to an advocate? And so this is really getting towards our core vision that I wrote on the very first slide about having a pocket companion for your healthcare journey, specifically for older adults. And we're so excited to be working with Hopkins on this specific core through line, because that's going to be the difference between a lot of the approaches of the past that haven't had quite as much success in making sure that these older adults get the resources that they need on a long-term basis. So with that, I'll pause. Apologies for rambling at you guys for 40 minutes, but I really appreciate your attention today, and hopefully we can answer a few questions. And if you do have anything that you wanna shoot me an email with, please do so. My email is Connor, CONNOR @callbaba.com. But yeah, with that, I would love to answer any questions. Okay, very interesting. How do you put guardrails around the AI implementation? That's a really good question. It's a lot of prompting. Actually, one thing I didn't mention was that we tested a lot of different models in terms of what gives the best personality. Any of you guys are designing AI companions, and we saw 27% increase in conversation and user conversation length when we switched to Claude models from Anthropic. Fun fact, they are by far the most personality and engaging. But guardrails is something that we're always kind of improving. When we were working with home care agencies, we had escalation alerts. So as the user, you could elect to put in an emergency contact that would get an in real-time text if certain triggers came up in conversation, including dizziness, acute pain, suicidal ideation, so that a caregiver, whether that's a family member or professional aid, could get an immediate alert. That's one form of the guardrail, which gives peace of mind, I think, to some families. But we just had a lot of kind of prompting and triggers around things that were maybe attempting to be sexual in nature. Some people always try to take things that route, and I think we made the decision that that was not the direction of the product, along with maybe more hateful things or things that it was trying to bait the product into saying. Cool. I appreciate your comment, Divya. Is it only in English? So yes, it's been optimized for English, but we actually had users successfully talk to it in Mandarin and Spanish. So I don't want to, advertise that it's seamless in every language, because a lot of our voices actually are optimized for English, including the pronunciation. But I encourage you to try talking to it in another language, and that's definitely something we want to expand to as we grow the company. What you described is really too good to be true. Do you need a lot of capital to develop the AI agents, technology development, run the operation of in-house healthcare professionals, therapies? Can Medicare, Medicaid reimbursement cover all the cost? So you're getting to the important questions of running a business. We are well-funded. We have a incredibly talented team of about half engineers from places like MIT, Waterloo, Carnegie Mellon, Palantir, Stripe. Our designer was the 20th employee at Headspace at Orange App, and then led design at Alltrails. So we really do, we have folks from the post-acute landscape that were actually CNAs before, people that have owned and operated home care and home health agencies before. So we have that deep, both technical and industry kind of experience, which is why we've been able, I think, to raise over $6 million, including from top healthcare funds that we will be announcing in the next couple months. But we definitely, it definitely is not cheap, and I think that gets at the really important part of building products in this space, and I think the importance of working with folks like the AITC who have seen the development of commercial products before for older adults. When you offer a service or a product for a very either vulnerable or a user that is very dependent on your service, you have an obligation to them to build a business that is viable around that offering, so that it's there long term, particularly if they come to rely on it. I think that's something we take very seriously, and I think that historically has maybe left room for improvement, where people don't necessarily think about what the unit economics need to be for a service to be around for a long time. And I've leaned on Anne and Peter's experience developing products like this, so we can really understand who our customers are and who the best payers in the ecosystem are. So I encourage you guys to work with them on that as well if you're considering doing a study together. And yes, reimbursement is a big part of the equation. CMS has been more innovative, I would say, over the last few months than perhaps in a long time, with some of the more recent models of how to reimburse outcomes rather than just labor. But I'm very excited that our therapy and our patient advocacy offerings are covered, by Medicare and Medicaid in certain states. This is often awesome. I see on your website it says Medicare covers costs for most people. For individuals under 65 not on Medicare, what is the cost? Is there interpretation translation concerned about our indigenous elders? That's a really good comment. I actually grew up going to Lenni Lenape tribe events in Delaware. So, but yeah, so I think what the answer to that is, like, if we divide up the products, right? So the business model for the AI companion is a freemium model. So anybody can sign up, they can text or call Baba, and it's based on a consumption-based pricing. So after you exceed an amount of talk or text time, then there is a monthly subscription. But to get started, it doesn't cost the user anything. On the advocacy and therapy side, that is, a healthcare product that is covered by Medicare, certain Medicare Advantage plans. So for folks that are under 65, that is not something that we offer through therapy right now. Those services, if we do have a user or a patient in that case that speaks another language, they can get matched to an advocate that speaks that language. Right now we support Spanish, but we don't have a huge patient population that have other languages, other language needs so far. But when those do come about, we definitely want to make sure that they can be supported as well. And also, if for any of these questions I'm not getting to the root of your question, please just post another one and we can keep going. How do we protect user privacy and personal data given to the AI companion? That's super important. So one of the things is that we're not training on anything in these conversations. We are completely HIPAA compliant. We go above and beyond in making sure that we're not going to have leakage of personal information. I would also say there are firewalls between what information is shared with a companion and what is shared with any sort of actual healthcare professional, whether that's a therapist or an advocate or a provider. That information is not shared freely, but it is presented as an option via the companion product by saying, do you want to talk to them? You can use that service through the product by signing up. It's actually a separate onboarding through the Baba website. Hopefully that makes sense. And what is the business model? So like I had shared, it's a freemium model for the companion product. We actually have a brain screen as well. It just runs through a couple like open source memory tests. Some people want to see if their memory changes over time based on voice as a biomarker, which is a whole other conversation, which is actually very interesting around voice phenotyping, which is the use of voice as a biomarker. And then the business model for the patient advocacy and the therapy, we get reimbursed by insurance plans. Oh, we got another one. So we don't seek in the companion product. We're not like probing for medical history. We really do keep the conversations almost a reflection of what the user or the patient is seeking to talk about, right? And that's intentional, since that information is not used for anything or trained on anything or shared with anyone. It really doesn't need to accomplish any sort of like information gathering. Will Baba remember what they say in their records? So yes, Baba has a memory of those past conversations. So I mean, that's core to developing rapport with any companion or human friend. So if you talk to Baba about your stress that your daughter is marrying someone that you don't like, they might, Baba might ask in a later conversation, has that your impression of your future son-in-law improved? Something like that. Any other questions?
So the last question I see on there just has to do with your email address. And I can tell everyone that this has been recorded and it will appear on the JHAITC website within the next couple of weeks.
Yep. And my email is just Connor, Connor, at callbaba.com, CALLBABA.com.
Connor, thank you so much for being with us today.
Thank you guys. I really appreciate it.
Take care.
Bye, guys.